I'm just here to talk about why I decided to pursue medicine from nursing. I wonder if that makes sense. But anyway, this is the thing. I first did a bachelor's degree in nursing, and then I worked as a nurse for about 2 years. And then I decided to go back and do medicine. So why? Like why? Why did I do this? I'm here to tell you all about it. So when I completed my A-levels back then in my country, my dream had always been to come and work in the UK. So the relatives that I knew back then kept telling me, oh, nursing is marketable in the UK, nursing is marketable in the UK. But then at the back of my head, I always wanted to be a doctor. So when I was applying for my first choice at university, I put medicine. But I didn't get this on government sponsorship. In Uganda, the government sponsors the best students for their first choice courses. So I didn't get medicine on government scholarship. So when this didn't happen, I was so devastated because I figured I was bright enough to become a doctor. So why didn't I get it? So anyway, I had a relative back then who was like the brainy of the family. So he decided to apply for me the private application to the university. I didn't even care what he put. So anyway, he put nursing as my first choice. He didn't even put medicine as the first choice on private. He decided to put for me nursing as first choice. And lo and behold, here I am on nursing on private in Makerere University. Now, pursuing nursing in Makerere University was so hard for me in the first year of medical school because I came across students that I was brighter than back then in secondary school. In secondary school, I was known as this bright child, especially my ordinary level. I was a bright student, and I knew that. And I knew that I was destined for greatness. But now, here I am in uni, and the people that used to look up to me as the bright girl are the ones who are doing medicine, and here I am doing nursing. It took a toll on my self-esteem. I tried to change the course to medicine back then, but it failed. So then one of the academic registrars in Makerere sat me down and told me, you know what? You've really worked so hard to try and change the course, but it has failed. Do this course, finish it, and there's always a possibility of you coming back to do medicine. At that time, I thought, he was just trying to brush me off, you know what? But anyway, that's when it occurred to me, I have failed to change my course to medicine. I might as well give nursing my best. So when I made up my mind to give nursing my best, the tables changed. I worked hard. My GPAs went up. My GPAs in my entire first year were just average. Like I was just passing. I wasn't putting in the effort that I needed to put in to be as excellent as I normally am. But now when I woke up in second year, I did my best. I gave it my A game, and I passed nursing with flying colors. Now, in the nursing class, I found some students who had already given in their A game from the first year. So my God, the important bit is you have to start as early as possible. So I couldn't surpass these students. So I passed my nursing degree as the third in my class with 2 students above me. So I was the third in the class. Now, when I finished nursing, I had already given up on my dreams of being a doctor. I had accepted what I had, even if I didn't like it, but I had accepted who I was. So I worked as a nurse. I did my entire internship, and then I worked for about 2 years as a nurse. But even as I was working, I wasn't comfortable doing this. And one of the things that I wasn't comfortable with is the attitude of doctors towards nurses. They would come and literally pass on their dirty work for you. So basically, nurses were viewed as the people who do the dirty work, and the doctors just come, do their ward round, and then they go. That's one of the reasons. And then the other thing is the ordering. They would literally, in Uganda, there's that relationship, the dynamics between the doctors and the nurses. Like the doctor is the boss, I don't want to be bossed around. I don't want to be bossed around. So I hated it. So because I hated it, I told myself I will not work in a clinical setting as a nurse, and I made up my mind not to do that because I don't like being looked down on. I don't like being downgraded, and I didn't like the whole feeling at all. So I was lucky that I was able to get a job in a non-government organization. By then it was called Baylor College of Medicine. At least in this organization, they were able to view me as a degree nurse, as someone who has some brains in their head. So I worked as a clinical trials nurse at Baylor College of Medicine. Now, working as a clinical trials nurse is what woke my love for medicine. It woke the passion that I had to be a doctor once again. When I was starting this job, I was taking over from someone who was going back to do medicine. So the nurse who had been doing that bit was going back to pursue a degree in medicine. And I remember when she was orienting me into the job, I asked her, but why are you leaving all this money to go back and do medicine? And she just told me one thing: you come back and tell me after 1 year of working in this job. And indeed, after working a year in that job, I wanted to go back and do medicine. And this is why. So in this organization, they viewed degree nurses as capable of seeing patients up to a particular level, like up to their limit, and then they would escalate to the doctors if there is a need. So when a patient would come in, we were working under a clinical trial. So in that clinical trial, the patient visits were scheduled in such a way that if a patient sees a doctor on this visit, the next visit the patient sees a nurse, and that nurse had to be a degree nurse. So because they expect you to have some level of decision making, some level of, like, your knowledge base is different. So, and then it occurred to me after a year that I am actually doing the same thing. Okay, not literally, but literally doing the same thing as the doctor is doing. If we can alternate the visits, and I see the patient on this visit, and then the nurse sees, and then the doctor sees the patient on the other visit. But the difference in our salaries was literally double. Like, the doctor was getting double my salary. Yet on the actual visit, we were filling in the same clinical trial paperwork. And if you've worked for a clinical trial, you know how meticulous that paperwork has to be. It's a lot of work. So I told myself, like, I'm doing all this work, the same amount of work as the doctor is doing, but still they don't recognize that I need to be paid at least up to par as to what the doctor is getting. I'm done with this. I'm done with this. Yeah, with this, I'll stop there. So then I talked to this girl that had gone back to do medicine. By then she was in her 4th year of medicine. And I told her to take me through, to mentor me into going back to do medicine. So she took me through the process, and then I applied to go back and do medicine. When I applied to go back and do medicine, it was in the same university I went to, that was Makerere. I didn't get in the first time I applied, and this is why. So remember, I told you I was the 3rd best in my class. So the person who was the 1st in my class had also applied in the same year. So they gave him the slot because it's merit based. So you have to have had a good GPA for you to be able to get that slot of medicine. So that person got the slot that year. I did not give up, guys. I did not give up. I told myself, Caroline, I want this. So the next year I applied because I knew now he had been knocked off, and I knew the second person in my class wasn't applying, and I didn't know about other people, but I knew there's a chance for me in the next year. So I applied the next year, and guess what? This time I got in. So I get into medicine, and now there's this whole process that I had to go through. This is the process. Because I had done a degree in nursing, I had done the first 2 years with the medical students. So the first year of medical school in Makerere, the first and second years are literally done together, at least in my time. So we did the same course units together for the first and second year. But from 3rd year going onwards, the nursing students go a different path and the medical students go a different path. So Makerere has a policy that if you have done those course units, you do not have to do them again. So they exempted me all the course units that I was able to do as a nursing student with the medical students. And this means I started medicine from 3rd year of medical school. I did not have to start from 1st year and go through the entire 5 years, which was great for me because at that moment in time, I was getting married. I was planning to have a baby. I didn't want to waste a whole 5 years. But even if it were 5 years, I was that determined. I wanted to be a doctor. I didn't care. Whatever the cost it was, I had to do it. So I went back to medical school. I completed my 3 years of medical school, and then I became a doctor. So after becoming a doctor, I thought, this is it. This is it. I am now a doctor. I'm done with books. I'm done with books. I'm going to be a doctor, mommy, and that's it. I don't know why I'm so ambitious. I don't know why. Like, anyway, all these things have taught me that there is no it in life. There is no it. There's no point where I say that when I get that particular thing, that will be it for me. My happiness will be complete. Guys, there's no it. So after getting my medical degree, I thought that was it. I started working, and then the fire to come and work in the UK started burning. It started burning, and that's where we are here. That's where we are here. So yeah, that's my story of being a nurse. And now here I am a doctor. Are you a nurse? Do you have dreams of becoming a doctor? Have you given up? Are people telling you that it's too hard? Are they telling you that years are so many? Let me tell you one thing. If you have the chance to go back and do medicine, it's going to take 5 years. And then people are telling you, oh, those years are so many. But 5 years, if you're 30 years old right now, 5 years from now, regardless, you'll be 35. So if there's that dream that you want to pursue it. Because the years will still go by. And if you didn't pursue that dream, you'll still be in the same place that you were right now. So I'm here to encourage you. If you have a dream burning within you, pursue it. But dreams come with hard work. Dreams come with commitment. Dreams come with pain. Dreams come with tears. So be prepared for that. Thank you for watching this video. If you still want to find out more about my journey, please hit me up on my Instagram page. We can chat. I can get to know each other. And I post content there from time to time. Bye.